Well, I'm Michael Alberts. I'm the Chief Medical Officer here at the Moffitt Cancer Center, but I'm also a practicing pulmonologist within the Thoracic Oncology program. Well, lung cancer happens to be the most common cause of cancer death in both men and women. It actually surpassed breast cancer in women in the 80s, such that it's the most common cause of cancer death in both men and women currently. It's been estimated about 200,000 people will be diagnosed with lung cancer this year, and approximately 160 to 170,000 of them will actually die from lung cancer. So it's a very, very common disease and a major health problem. Well, one of the problems with lung cancer is the fact that signs and symptoms only appear late. And if you wait until signs and symptoms of lung cancer appear before you make the diagnosis, it's often too late to actually cure the disease. That's why screening for lung cancer has been so interesting and well studied. But prior to a recent study, there have been no modalities that actually are effective in lung cancer. That's why we're so excited about the new study that has come out showing that low-dose CT scanning is effective in providing a mortality benefit. It actually appears that about a 20% reduction in death from lung cancer in those individuals who are screened with low-dose CT scan. So if you're in a high-risk group, this may be very, very beneficial for you. Of course, the mission of the Moffitt Cancer Center is to prevent and cure cancer, and this is a major advancement in the possibility that we may be able to cure lung cancer in many, many more people. If the patient happens to be in one of the high-risk groups for lung cancer, we've always suggested that they talk to their physician about screening, or they make an appointment to see one of the lung cancer experts here at the Cancer Center. Of course, it's important to know that this is an NCI-designated cancer center. This is all that we do is cancer-related treatment.
Lung cancer screening is very important. Lung cancer kills more men and more women in this country than breast cancer, colon cancer, cervical cancer, all put together. Yet we have screening programs for breast cancer, we have screening programs for cervical cancer through pap smears, we have screening programs for colon cancer with colonoscopies and digital rectal exams. However, until very recently, there was no screening programs for lung cancer, the #1 killer cancer. However, with new technology and CT scans and PET scans, we now have a great screening program for lung cancer. Screening for lung cancer catches cancers earlier, when it's way before you get any symptoms such as coughing up blood, losing weight, or having trouble breathing. And if we catch your cancer earlier, in an earlier stage, we have more of a chance to cure this cancer and have a good quality of life. There's no doubt that lung cancer screening with CT scans does expose the individual to radiation. However, that dose of radiation is tiny and very safe. In fact, lung cancer CT scans for screening are very different than CT scans of the chest for other reasons. They're about 1/10 of the dose of a regular CT scan for screening if it's done in an institution that's specialized in lung cancer screening. Also, to put it in perspective, CT scans for lung cancer screening give about the same amount of radiation as a mammogram for screening for breast cancer. So why choose Moffitt for lung cancer screening as compared to many other institutions that do offer screening CT scans for lung cancer? Well, I'll tell you, for one good reason is the fact that we're experts in cancer care. That's what we do, and that's what we do every day. Lung cancer screening picks up a lot of abnormalities on a scan. And the majority of these abnormalities, in fact, over 90% of the spots that we find on a CT scan for screening are not cancerous. And if you go to a place that doesn't do a lot of lung cancer screening and don't have the multidisciplinary approach, meaning different specialties that all take care of lung cancer, such as thoracic surgeons, such as myself, pulmonologists, medical oncologists, and radiation oncologists, then unfortunately you may end up with unnecessary testing, unnecessary procedures, unnecessary anxiety from having somebody advise you that may not have the same expertise as you would have from all the different experts at Moffitt who deal exclusively with lung cancer. So sometimes lung cancer screening does find early tumors. What's good is that we find these tumors before they grow too big. If the majority of tumors we find once a patient has symptoms such as coughing up blood or having trouble breathing are usually too large for minimally invasive surgery, meaning keyhole surgery. However, with lung cancer screening, we find very small lesions, lesions that are about the size of a blueberry. Because we find these lesions early and that they're still small, we're able to offer here the expertise that we have grown over the last few years here at Moffitt. We offer robotic surgery and minimally invasive lung surgery. We're able to take out a lung cancer with 3 little cuts. Patients go home within 3 days and have a very quick recovery. Another advantage of enrolling in the comprehensive lung screening program at Moffitt is that patients would have access not only to a panel of experts who deal in lung cancer, but they'd also have access to some groundbreaking clinical trials, new types of medications, new types of interventions that we could offer patients if they have precancerous lesions. And these are types of medications, these types of therapies that may not be available in other screening programs, in other hospitals or other institutions.
Joe Garrett, I am one of the nurse practitioners. I work in the thoracic oncology program here at the Moffitt Cancer Center, and we are very proud to have a comprehensive lung cancer screening program. The eligibility for participation in the lung cancer screening program is an age between 55 and 74 years old and a smoking history of approximately 30 pack years. Pack years are defined as 1 pack a day for 30 years, or 2 packs a day for 15 years, or 3 packs a day for 10 years. If patients meet these criteria, we highly encourage them to come here to Moffitt and have a CT screening exam done. For patients that do not meet the criteria, they can call Moffitt and we would be more than happy to arrange for an appointment with one of our Moffitt pulmonologists or medical oncologists or thoracic surgeons for evaluation.
Hi, my name is Nicole. I'm one of the nurses here at the Thoracic Oncology program. The process to getting involved in the comprehensive lung screening program is very easy for our patients. They start off by calling the new patient appointment center to make an appointment. After an appointment is made, they're given various options for times to have a low-dose screening CAT scan done. The CAT scan can be done here at our main campus at Moffitt. It's done Monday through Saturday, 8 a.m. to 7 p.m. And then it's done also at our Moffitt International Plaza location, Monday through Friday, 8 to 4 p.m. Once patients have their CAT scans done, then they're reviewed at our tumor board. There it's discussed in detail, and then recommendations are given to each patient. The recommendations can include anything from coming in for a visit with our clinic staff or annual screenings. If annual screenings are done, we do call every patient to remind them that their screenings are due in a year, and they can opt to have them done again here at the main campus or at Moffitt International Plaza. Our comprehensive lung screening program here at Moffitt takes a multidisciplinary approach. Every case is discussed individually at our tumor board. At the tumor board, present is a radiation oncologist, a thoracic surgeon, a thoracic medical oncologist, radiologists, pathologists, nurses, and nurse practitioners. Each case is looked at thoroughly before a decision is made and results given to each patient.